What is the standard of care when it comes to breast conserving therapy? In other words, lumpectomy. Well, in general, always part of that standard of care is having some kind of radiation therapy. The radiation therapy can be of the whole breast. It can be just of the area where the cancer was. And remember, that's called accelerated partial breast irradiation. Now, are there exceptions that women who have had a lumpectomy don't necessarily need radiation therapy? And the answer to the question is yes, there are exceptions. There can be tiny areas of in situ breast cancer, as an example, that is a reason if you take out a large enough lumpectomy specimen with wide margins and a low-grade cancer that you may not need radiation therapy at all. And so those decisions, though, are made on an individual basis, working with a multidisciplinary team. There's also been a fair amount of data that perhaps women who are older than age 70 don't need radiation therapy after lumpectomy. But we've got to be careful about this recommendation because, again, even in women over 70, not all cancers are the same. Often in this age group, these are smaller cancers, especially if they're found with screening mammograms. They're usually estrogen receptor positive, so the patient will be put on an anti-hormonal regimen. And with women who are older than 70, particularly as women get into their 80s or so, they may have other illnesses. We call those comorbid factors. So that the percentage of women older than 70 that may not need radiation therapy may be smaller than certainly those under the age of 70. I'm looking here at a study from the Department of Radiation Oncology and Surgery at the University of Pennsylvania in Philadelphia. This is a 20-year analysis using what's called SEER data, S-E-E-R, surveillance, epidemiology, end result. This is the largest sort of population-based database that we've got that the federal government maintains. It's a wonderful source of research. And so one of the things that this group did was to look at the 20-year time period from 1988 to 2007. And the thing that I'm going to particularly focus on in this paper was the omission of radiation therapy. And what they found was there was sort of a steady state of approximately 20% of patients not undergoing radiation therapy. Now, in all fairness, the authors do point out that whether patients had radiation therapy or not is one of the difficult parts of this particular national database to have filled in properly. Or to put it another way, that people may have had radiation therapy, but it simply didn't get recorded in the database. And so this particular study also looked at the incidence of mastectomy over this 20-year period and found that the people having mastectomy rate was going down. But I want to focus on the issue of radiation therapy. And what was fascinating to me about those who did not in this database have a radiation therapy was, besides being elderly patients or older than age 70, there was also a lower percentage of people who are African American who did not get radiation therapy. The use of radiation therapy also varied geographically within the United States, with a lower incidence apparently of using radiation therapy in the South and the Southeast. The highest use of radiation therapy was in the Northeast, and then it varied around the country. So what's the important part of this? And in the discussion that goes with this paper, they did point out that other series show that the use of radiation therapy can be as high as 90%. For those who are worried about radiation therapy, and we know there are people worried about it, that perhaps the radiation therapy itself can cause cancer, or I've done a previous video about damaging the heart, or just the overall fear of radiation therapy, which can vary tremendously by cultural groups. In my own experience, as an example, there's a great deal of fear in the Hispanic community to have radiation therapy. A lot of these are cultural myths that are passed down the way. But if you're going to have breast conserving surgery, in general, please remember that you always need radiation therapy. The data is really clear. When you have the radiation therapy, the chance of the cancer coming back in your breast goes down. Survival is improved. The benefits are irrefutable as when it comes to radiation therapy. Please also remember that there are choices now for radiation therapy. From the traditional whole breast radiation therapy that'll take 6 weeks, including boosting the area where the cancer was originally, now shortened down then to whole breast radiation therapy called hypofraction at 3 weeks, coming down to accelerated partial breast irradiation, APBI, where devices can be put into the breast, or the ultimate of accelerated partial breast radiation therapy is intraoperative radiation therapy. And when it comes to intraoperative radiation therapy, we can do that at the time of the lumpectomy start the radiation therapy, and that's called the boost, or in selected cases, intraoperative radiation therapy can be used as what's called a single fraction, meaning one shot and you're done. That kind of treatment in the United States, the single fraction, is being done under research protocols, which is appropriate. The research in single fraction is more robust when it comes to data out of Europe. It's clear to me that more and more women are going to want single fraction, and that it's a really excellent alternative, but you've got to be working with a multidisciplinary team who know the limitations of the single fraction. So please find such a team. Please look at all the options, and please have the necessary radiation therapy. The Mobitron is a mobile, self-shielding linear accelerator used to deliver intraoperative electron radiation therapy for the treatment of breast and other forms of cancer. To learn more about this exciting and cutting-edge technology, please go to intraoperativemedical.com.